met before. We had given a presentation a couple months ago on just maintaining overall health and wellness during return to racket sports. So if any of you are interested in learning more about that, feel free to contact me at the end. Today, we're going to be talking about just general optimization of our longevity. So being active, staying active, and avoiding falls. As we get older, it's something that we know is a possibility, but there are ways to mitigate that risk. So a little bit of background on me. I am a board-certified doctor of physical therapy. I've completed a postdoctoral residency program and a orthopedic board exam, which makes me a specialist in orthopedics. And our whole team really works together to fill in whatever pieces are missing. So we don't just look at your knee, your back, your balance. We look at you from an overall health lens. So as we kind of go through this today, you're going to hear a couple different ways that I play a role, Scott, or if you have a different personal trainer, would play a role, and how we can just tweak little things here and there to make sure that you are staying active as long and as safe as possible. And so this is a little bit about kind of our lens here. So our title is Be the Best Form of You. So that's really what I want this to kind of come back to at the end of the day. So we're here to serve as an expert and a resource. And we want to leave you with things that you can take away today so that if you are at the stage where you can handle things on your own, you can improve, but then we always are there as that background. We're here to be a resource. So in general, what do we need to be active? We need mobility and stability. And when we think of, especially any racket sports, so tennis, pickleball, padel, we need a lot of rotation at the spine. We need a lot of cardiovascular endurance. We need strength. Those things are always going to be the background and the foundation of our balance. So we need to be able to take that foundation and then apply it in a quick reactive moment. So whether that's jumping to get the ball, or whether that's you're tripping and midair, you're falling, there's no age that is safe from falls. There's ice. You never know what's going to happen. So this isn't just going to be about as we get older falling. It's all across the whole lifespan. So as we can build from that foundation, then we have more of our strength and power and our speed and agility. Endurance is a big factor as well. As we fatigue, we're at risk more. So if we can expand our cardiovascular capacity, then that's just going to allow us to be more robust. And the big one is balance. So what is balance exactly? So it's our ability to maintain an upright posture and keeping our center of mass over our base of support, so our feet. When you're playing sports, our base of support is constantly changing, so your body is constantly trying to keep yourself upright and stable. So our postural control. So if we don't have postural control, then we don't have balance. So balance is broken up into both static, so just stationary. So me standing here right now, I have static balance. You sitting there right there, you have static seated balance. And then we have dynamic balance, which is more challenging, and that's what we want to think of when we're playing sports. We also have our reactive, so that's more you're slipping on ice, you catch a ledge, your body's reacting to it. You don't know it's coming. And while we can't prepare for every exact scenario and situation that may come about, there are things that we can do to make you more robust for that challenge to your balance. So strength and mobility, having the range of motion and the strength to catch yourself and maintain upright, keeping that center of mass over our base of support is huge. And then we have the anticipatory control. So that's where we know that either we're about to make a dive or we're about to move quickly, and we know that we need to make these corrections to where our body is. So all of that is going to go back to that foundation. There are multiple different systems that contribute to our ability to balance. You may notice sometimes, especially at night, if you're walking around the house in the dark, it's easier to lose your balance because our visual system sends signals about where we are in space, what position and direction our body and our head are in, and that is really important. And that's why sometimes having little night lights along the hall, just making little modifications to our house or wherever we are that we can is one way to help with balance and reduce fall risk. We have our somatosensory system, so our sensation. Our feet, as we're standing, are sending signals to the rest of our brain about where we are in space based on where our pressure is, based on the surface of the ground. So if the ground's uneven, that little slight lip based on if there's a pothole, that is also what's going to contribute to our balance. And then we have our vestibular system. I don't know if anybody here has had vertigo, but that essentially is telling our brain where our head is in relation to space and gravity. So if anything is kind of slightly off, that can change our balance. And it can be short term. You have an acute flare of vertigo. If the world feels like it's spinning, you're not going to feel very balanced. And that can throw off how we're walking and our safety. So as we're talking here, there are things that we can't plan for, like having a flare-up of vertigo, where not only physical therapy can help, but just being prepared and having that knowledge makes it a little less scary and makes you able to make changes to make everything as safe as possible. So we have our corrective strategies of balance, and so I don't know if any of you have ever felt like you were about to lose your balance and your ankles kind of sway up and down like this, and then our hips. So we have hip strategy. And so what these things do is they help make changes to keep that center of mass over our base of support. Then the next kind of step up is our protective strategies. So that's when you actually take that step forward. You stub your toe a little bit and you catch yourself. Or you grab onto something. Hopefully none of you have experienced that, but there are two kind of principles towards training our balance when we have to break down, do we have the mobility and the strength in the hips and the ankles? And then do we have that mobility and strength to catch, to step forward quickly? Because if we don't have those, then there's no use trying to push and train balance. We got to kind of start at the bottom. So how do we assess balance? How do you know if you have good or bad balance? All the time we have people come in saying, oh, my balance is horrible. And then, we have them stand on one leg. We have them stand a certain way. And it's not that bad. But that's, again, more of our static balance. So there's more to it that meets the eye. And there are a lot of different ways that, whether it's me as a physical therapist or a doctor, can quantify the degree of the balance impairment or the strength of the balance. So we can do kind of, if you're thinking of just bread and butter, timed testing. So this gives us a good overview of where you're at and where you're starting. So we'll start by having, and I don't know if you guys can see my feet, but just having people stand with their feet together. So we're narrowing that base of support, keeping our center of mass where it is, and that's changing how we can react. So if you ever do try, have somebody around. Don't just kind of try on your own if you think that balance is a safety concern. But just notice that it does make it a little bit harder to balance. Then we can also do a semi-tandem. So that's one foot slightly in front of the other, as you can see there. And then the bottom one is one foot in front of the other, like you're walking on a tightrope. The next progression would be standing on one leg. And these are all ways to see, as we narrow that base and take away part of what you're used to having, can your body react? Can the ankle muscles keep you as you sway? Are your core and your hip muscles keeping you upright? Are you leaning forward because you don't have the strength? Or is it more so that's just the way your body is reacting? So this gives us an idea of where to start if we do find impairments. Then there are other variables. So if I had everybody standing on the ground, everybody could do great. But then the second that I change the surface that you're standing on and put you on an Airex pad or something squishy that has a little bit more give to it, that's going to be a lot harder to stand on. And you may think like, oh, but I don't walk around and stand on squishy pads all day. I go to work, I go home, the beach. If you're on the grass, you're all active. You're here because you are active and you want to stay active. So that then gives us that further insight to how your body is going to react if, let's say, it's a little muddy and the ground has more give, or if you're on the beach. So vision, as we said, also plays a role. Maybe you can stand on one foot for 10 minutes because your balance is great, but the second you close your eyes, can you stay upright? It's very challenging. I would not recommend doing without something nearby to hold on to. And then movement. Can you move your head and challenge your vestibular system? Because now, as our head is moving, that's going to put more of that strain on our vision and our somatosensory systems to kind of take up the slack. So whenever we have one of the three, whether it's closing your eyes or in the dark, or like I said, moving your heads, then the other two have to kind of pick up. It's like if one of your coworkers is out on vacation, you may have to take a couple extra hours of overtime to just help keep everything going. Same thing with balance. Everything is a give and take, and we can tune in to where we need to train systems more to really give you as strong of that foundation as possible. So there are a lot of different standardized outcome measures that have undergone rigorous clinometric testing, and I won't go too into that, but there are ways to test our dynamic balance and our static balance that we can use at the beginning, maybe a month later, maybe a couple months after that allow us to see your progress. And they kind of categorize based on your score where you fall in terms of if you do have any risk for falls. Is it low? Is it mild? Is it moderate? And then we can track your progress. So that gives us more data, and we can use that to see what else we need to improve on. Because if you're scoring 100% on one of the tests that just tests static balance, okay, I know then I need to progress and add in a dynamic balance assessment. So there's a whole continuum that we can do in addition to just watching the way you're moving, watching the way you're playing your sports, and in order to individualize the care and the treatment. So some of these we have, it's called the Berg Balance Scale, we have the Tinetti, there's the Dynamic Gait Index, there's so many that I won't bore you with, that I had to learn in PT school. Then we have, just in general, if you want to think of your balance, if you're riding a bike and you're riding pretty slow, you're more likely to fall off. It's the same thing with walking. There's been a lot of studies that show as we age, we have a tendency to walk slower, so our gait speed decreases. If we can keep moving at our normal speed, we are less likely to fall. It's the same principle. So we can test your walking speed and see if that does also put you at risk. So just a little breakdown here. It's called the TUG, the Timed Up and Go test. And essentially what it is you just stand up from a chair, walk 3 meters, turn around, and sit back down. And if that takes you however many times, if it's less than 12 seconds, you're at a lower risk for falls. And then we can kind of see with each increase in time, are we at a risk for falls? There's also more specific data based on age group. So if we are concerned, then we can kind of delve into that. But if you're able to do it in 8 seconds, then I know your walking speed is good, your dynamic balance is good, and I can start to progress things and push you more. Because the thing about balance is you need to be challenged in order to improve. So training balance, having you do all these crazy things while standing a certain way, whether it's on one foot or in that tandem position, it needs to be to the point where you're about to step, not fall, but lose your balance. We're there to catch you if needed, but that's why it's important to do these things with a trained professional. So whether it be me, a physical therapist, or Scott, a personal trainer, there are a lot of people that we can kind of add on to the team to help develop those balance skills. So like I said, do not try this at home. And then building that solid foundation. So having good strength, having that mobility, because your body's going to have to move in certain ways in order to maintain that center of mass over the base of support. It always goes back to that. So improving through exercise. I know a lot of my patients that when they come in for just general balance impairments and they're afraid of falls, their doctor wants them to come so that they don't have another fall if they've already had one, or to prevent one. They expect to do balance the whole session. The first couple of sessions, we're purely working on strength. And Scott does the same thing with a lot of his clients. So it's just really making sure that you have as much strength as possible. Not only is that going to reduce your risk for falls, but it's overall a good thing to have. As we get older, it is harder to gain muscle mass, so it allows us to maintain and continue to build so that you can be active as long as possible. So, unfortunately, accidents do happen, and falls do happen. Sometimes, as much as we train, there are certain situations. My one patient, he always says, the ice doesn't discriminate. Doesn't matter what age you are, but winter is coming up, and who knows? I could fall, hopefully not, but I know how to fall, so I don't injure myself. And I'm going to help share some of that information so that you guys can feel more confident that if you do find yourself in that situation, you have some sort of training, so you feel more prepared. So this is a picture from a rugby handout, and rugby, they tackle and fall a lot without padding, so if it works for them, it's going to be helpful for all of us. So ultimately, the big thing is protecting our head. When we fall, we don't want to hit our head. We don't want to have any concussion or any sort of brain injury. So at the end of the day, if you can take away one thing, it would be protecting your head. A lot of people's first instinct when they fall is to put their arm out. We don't want to fall on an outstretched hand because that puts us at a lot higher risk of either fracturing our wrist or breaking our arm someplace. So you want to think of bringing your limbs in and then trying to land on one of the softer areas. So maybe, the back of the hip there is a little bit better than the side of the hip. Ultimately, it's about trying to land where you got a little bit more cushion so that you do protect your bones. And you want to think of kind of going not fully limp, but you don't want to be super rigid, because then when you land, then you're going to land harder. I don't know if anybody has seen any of parkour videos or people jumping off of high surfaces where they land and then immediately roll. I'm not telling everybody to go and tuck and roll and somersault if you do have a fall, but just try to think of maintaining that movement, because what that's going to do is help disperse that force. If we have more time of the fall, it's going to be less immediate force and the body can absorb it through more areas, and it's not going to be as dangerous. So if you think of an airbag, it's going to help disperse that force and lengthen that time. It all goes back to physics, unfortunately. But fortunately, because then we know more and we can be prepared. So red flags. What happens if you either are with somebody who falls or you are the person that falls? A lot of people immediately think of getting up, but then there are things where overall safety-wise is more important, and it's safer to actually stay on the ground and wait for medical assistance or medical attention. So any type of loss of consciousness, you don't want to just kind of shake it off, brush it off, and go about your day. If you see that one of your limbs is kind of bent in a direction that it shouldn't be bent in, please don't try to put weight on it, push on it. You'd be surprised. People, even if it's a finger, you don't want to risk making that worse, because that unfortunately means that you do need some sort of surgical intervention, and you don't want to risk compromising blood flow or any of our neurovascular structures. If you have extreme pain or you're unable to move a body part, especially the leg, the hip, you don't want to go try to move and put weight on it, because there could be a fracture or you could have some sort of other injury. So when in doubt, it's always better if you can't bear the weight, don't try to get up. Unfortunately, that would be an indication where calling 911 or calling somebody who can help you move safely is the better option. Because when these things do happen, we don't want to think of, let me just get up and brush it off. We want to make sure that we are not doing anything to cause further harm, because now we're not thinking about preventing a fall. We're thinking about returning and getting back afterwards once you're medically cleared. And then if you fall, especially and hit your head and bend your neck in any certain way, if you lose sensation in any of your limbs or you can't move them, not because you think you may have a fracture, unfortunately, neck injuries do happen. And it's important to make sure if there is any risk for fracture in the neck, especially if you had a fall down a couple stairs, or if you're just moving with more momentum, that we do make sure that there's nothing there that could result with more of a neck injury. And then head injuries. We see this all the time, especially now in football, concussions, and even worse, sometimes we do have brain bleeds. These are things to kind of look out for that indicate that you need to seek immediate medical care. So double vision after the fall, double vision in general, if you do start to experience it, is something that's telling you that you need to see a doctor. Seizure, when you don't have a known history of seizures. If you vomit more than 2 times after hitting your head. Worsening headache or the worst headache of your life. Any type of major personality changes. And this one's hard because if it is you, you're not really aware. But if you're with somebody and you know that they had a fall recently within the past couple of hours, or if you are there, and they're more agitated, they're anxious, they're more restless, they don't seem like themselves, they're angrier, they're sometimes even violent, then that is a sign that there could be a more serious head injury that warrants medical intervention. And then any type of visible deformity of the skull, obviously same thing kind of with if your leg or your arm is bent in a way that it shouldn't be, please see a doctor. So the aftermath. Let's say none of those situations occur and you fell, you're a little banged up, just bruised, and you're like, okay, what now? After you do that head to toe scan, make sure you can move everything, head, shoulders, knees, and toes. Move around, see if there's pain. If there's not, then it's more than likely safe to get up, in theory. Then we have to think about, can I get up? So when's the last time that somebody got on the floor and then got up without thinking about it? You don't know. A lot of people actually avoid getting on the floor because they're afraid that they can't get back up. And that's super common. So unfortunately, people realize that they can't get up off the ground after they have fallen. Sometimes there's a couch or a chair nearby, and that can help you up, but sometimes there's nothing really there, and our goal is to also help with the training so that you can get off the ground. And then I'll also go over how to help somebody else get off the ground with the right body mechanics. So it's important to practice. So ultimately, and I'm trying to think of, if you guys, can everybody kind of see me if I'm over here? So if you're kind of out in the open and you've fallen, you want to bring yourself kind of up to both knees and then get one knee up. Whatever is your strong preferred leg, because then you can use that leg. It's kind of like doing a lunge. You can push off your knee and drive up. It's easy if you have a chair or somebody else nearby. The key, if you are going to help somebody, is making sure that you also have the strength to do it. You don't want to try to be the hero and then realize that you don't, and then you're both on the ground, and then neither of you can get up. So making sure that you're lifting with your legs and not your back. You don't want to just hold somebody's hand. You kind of want to get as much of a grip on their arm to help them and not yank on them. If you keep your body weight close to them, that's going to help prevent your center of mass from being pulled forward and you losing balance while helping somebody off the ground. So if you are the person who has fallen, again, maybe it's not an ideal situation. You're in the middle of nowhere near furniture. You want to be able to know and have that confidence that I have the strength to get up off the ground. I have the mobility. I know I can do this. Because it is a little bit scary, if you do fall. You're shaken up and people try to get up and then fall again. So my goal would be, whether it's any of my patients, and I'm sure Scott can say the same thing, any of his clients, feel that they have that confidence, because we don't want you to be fearful, and then that play a role into then falling again. So this is just kind of the breakdown. So getting into the kneeling position on both knees, swing one leg forward into the lunge, and then push through that front leg. So a lot of people always ask me when they come in, like, I'm here for my balance, but I don't really understand how I got here. So we look at that full lens. It's not just your strength and your mobility. It goes into your nutrition. Are you maintaining enough body weight and enough protein to continue to build muscle? Are you hydrating enough? A lot of people don't like to drink as much water as they should. So that means when you go from either lying down or if you've been sitting for a while and then you stand up too quickly, you can get what's called orthostatic hypotension. So that's where your blood pressure drops a little bit, because as we're changing, the heart has to beat faster, harder to get the blood to go further up to the brain, especially if you're going from lying down to being upright. And that, like, whoa, like I see stars for a second, and then it goes away. That's what that is. So maintaining proper hydration and electrolyte balance is really important for preventing that, because if we are so dehydrated, then we're not going to have enough of that blood going as quickly as we want, and then that's when you can stumble. Sometimes if it's very severe, people do lose consciousness, and why make things more difficult? Just drink water to prevent dehydration. We can also just look at, other than strength and balance, we want to look at the way you react to certain things. Not only is that your physical strength, balance, coordination, but also the mental side of things. With this company, we also have mental performance coaching, so more of that like sports psychology, if you want to think of it, where they can help assess your current strategies to respond to any sort of stimulus, whether it be athletic or reactive in a fall, and then teach you new strategies, because these things happen so quickly. You want to make sure not only are you physically ready for it, but also mentally ready, because that is a huge component. We want to look at your recovery. Are you more at risk for falls because you're not taking care of your body, you're doing all of these athletic events and not giving your body that time to recover, you're not getting proper sleep? Nutrition plays a role into that recovery. Are you properly fueling your body after you've been active? Ultimately, we want to get the most out of the exercise and the athletic activity that we do, and that's what comes in with recovery. So hydrating, being well fed, we don't want to dip on our protein, just making sure that we have every single piece of the puzzle analyzed so that we can come up with a game plan. And it's a team-based approach. It's not just one person trying this, trying that. It's especially important to incorporate as many experts as you can. I'm not going to pretend to be an expert in every single thing. I know when I need to bring in another team member to help give the best result. So whether it is like our company or wherever you go, you just want to make sure that you're taking that bird's eye view in order to make your best treatment plan. So the health and wellness assessment, it's called an optimal health assessment, and we go through an extensive history of everything I just kind of covered, and then it's really customized to what your goals are. So if you are afraid of balance, of course we're going to look at your balance and we're going to look at your strength, but just making sure that we are covering every single thing so that we can include it in our plan. We can discuss sport optimization. It is tailored based on the hobbies, the activities that you want to do or are doing, and then it's really working together. It's not one person kind of barking those orders. It's working with you. You're in control of the journey, and the journey is to make you able to confidently live your most optimal active life for as long as possible. So a lot of people say, how often are we doing these assessments? When do I know that I should come in? So people do it as an annual, once a year, check-in. This is going well. I just want to make sure. I want to get my statistics. I want to find as much data about my body as possible. things that are coming out like wearable technology. So like I wear an Oura Ring, there's Whoop straps, people have Apple Watches, Fitbits. That all gives us data that we can then analyze to make some tweaks to optimize how we are doing with our health and wellness. Some people do it twice a year, or they kind of start up after a fall or an injury. It's then that we reassess and kind of retest everything on a regular basis so that we can track progress and we make sure that you are satisfied with what you are doing and changing and what we are working towards. So this is an example for those of you that did come to the previous racket sport presentation. This may look a little bit familiar, but this is what it would look like if you were a tennis player looking to optimize your tennis game and play as long as possible. So the health professional, in this case that would be me, the physical therapist, I would do my assessment and I would look at the overall health markers. The racket coach, so if you are working with a coach or one of the pros, having regular conversation with them, maybe it's changing how frequently you're training with them in the beginning so that physical therapy or personal training, the fitness professional, so in this case Scott, how often we're getting those inputs. Because it's all about, especially in the beginning, creating consistency and making those positive habits and changes so that you get the most out of what you are doing. So that communication between the team is so crucial, because if all three people are thinking separate things and not on the same page, you're not going to get that benefit. So again, like I say, whether it's with me or somewhere else, always making sure that everybody is on the same page so that you get the most out of what you are doing. So know your body and listen to your body. That's the most important thing. If you feel like there's any more recent changes especially, and you are aware of that, don't wait for something to happen. Be proactive. Have your team in place. If you're proactive and you have that team, then you know that you can be confident in your abilities. So this is where our clinic is. If anybody does have any questions, I'm going to take questions at the end. And then if you want to chat afterwards, privately, I'll be here to answer any questions. And I'll give you guys my contact information as well. So with that, does anyone have any questions?
I didn't see where you were on the map.
Right here. Right by the Dairy Queen.
So Renee, a lot of us, I think in the room, my kids here behind me, are on Medicare.
Mm-hmm.
So do you need to have a referral to do this?
Yes. So if you are choosing to go through health insurance and you have Medicare, Medicare does require a script to initiate physical therapy. We do offer cash-based that's a little less governed and controlled. It's more whatever you are looking. So Medicare doesn't always cover as much as people would like, especially when it comes to more of the optimal health assessment and balance. We can initiate the program, but sometimes people do end up making the switch and then choosing to work on multiple things at once. Medicare kind of is, you focus on one thing and, we'll be able to make things work as long as possible, but just knowing that there is that option where we have that freedom to utilize whatever we think is necessary for the treatment and not hit our kind of like ceiling effect.
How is that coded in Medicare? Like they're disease oriented? Is there an optimal health?
So not necessarily, like we wouldn't code it and tell Medicare that specifically. That's just kind of more under the general assessment and intake process. That's how we start every intake, is with that optimal health assessment, whether it's Medicare, whether it's private insurance, after surgery, injury, balance. So it's just Medicare tends to cut people at a certain point once they think you're kind of at when you've reached medical necessity. But we do have that backup. Any other questions?
So I run a lot, and
Mm-hmm.
I fall a lot. So you hit an uneven piece of pavement,
you know you're going down. It's very, very hard.
Mm-hmm.
Think, oh my, I should go over my shoulder, or below, you know, that part of my body.
Mm-hmm.
Is there any advice? I mean, it happens in a nanosecond.
Mm-hmm.
And the natural reaction is to put your hand out.
Mm-hmm. So I would say like the two biggest things that take more, like you said, it's natural to reach your arm out. If you can kind of do that and protect your head, those are the big things. A lot of it is that psychological and cognitive awareness and how you process the fall. So that's why the mental performance and the coaching and strategies that they have is one of the things that if you guys are interested in learning more about that, we can always do a whole separate presentation. We have a whole team that are very qualified and do either one-on-one or group sessions. So if there were a lot of you that were concerned about falls, then we can get together and do like a group session where everybody kind of listens, learns, and gets that benefit. So there's a lot of things more so than just I'm upright and then I'm down on the ground.
That's how I usually feel.
Got to protect the noggin.
Okay, last question.
Mm-hmm. Yeah.
So back to what he was just saying about falling. I mean, you're ultimately trying to protect your head, number one, right?
Mm-hmm.
So
Yeah.
when your hand, like say you fall forward, you're not
Mm-hmm.
gonna put your shoulder out. You're gonna put your hands to protect it, right?
That's people's first instinct is to land like that, but it's actually better to kind of land on the shoulder more so, and obviously keeping your head off from face planting.
Right.
But that like roll that kind of naturally occurs is like the big thing where if people think that this will give them more time to protect their head and their face, but if you're able to shoulder the fall and then roll into it a little bit, and again, this is the ideal situation. Not all falls are the same, and there's no real way to be prepared for every single fall that may occur, but it's just optimizing and reducing the risk of fall, but optimizing the strategies in place for your body to react and safely react to the fall. And again, safety-wise, if it's a more high-speed fall and it's a dangerous mechanism, it may be better in that scenario to protect your face and the rest of your body, and you may need to kind of land with the arms a little bit, but ideally in a perfect world, it is better to kind of land on the shoulder. Yes?
Do they make airbags for people?
Not yet, but if anybody in this room has any good engineering friends and wants to make a lot of money, then that wouldn't be a bad idea.
I think it's called a tank.
Mm-hmm.
I said I think it's called a tank.
Mm-hmm. Oh, it's already a thing.
It's almost like a tank.
Oh, interesting. Any other questions? Any other questions? All right. Well, we did collect. Yeah. Mm-hmm.
I know there's some people around here that are fanatic about cryotherapy.
Mm-hmm.
What are your feelings about that?
It's a really helpful recovery tool. It's good for reducing.
Renee, can you tell us what cryotherapy is?
So if you think of cryo is cold. So it's any type of treatment involving either like an ice pack, or I don't know if anybody has seen like the full body cryotherapy tanks where it's like negative 180 degrees that you go in for 2 minutes. It's really good for reducing systemic inflammation and improving your recovery. So again, if you hate the cold and you're like, I'm going to be miserable, I don't care how good it is for me, I'm out, then that's you. Everyone is their own person, and there's so many other options. It's not the end all be all, but it is a very powerful tool.
Is there much evidence-based for the effects of it?
Yeah, and again, they have gone in and looked at overall recovery markers, inflammatory markers, and then also injury-wise, the same kind of results. And there has been studies that show that it is helpful at improving recovery and overall, whether it's from injury or just full body. It makes you feel good, get your heart racing, unless you despise the cold, then you might not feel so good. But again, it's a short amount of time if you're doing full body cryotherapy.
Is it fair to ask if you do it?
I haven't tried in a very long time. The first time I did it, it was very cold. And just in terms of time-wise, for me, if I do feel like I need some cryotherapy, especially it helps me wake up in the morning, I'll do like a cold shower, start with cool after, the scalding hot, cool down gradually, in the last like minute or two, have it be as cold as tolerable. Kind of gives a similar level of effect if you want to try out and see, do you like it, do you not like it? If you do it in the morning, it can help revitalize you and wake you up for the rest of the day. Definitely in that minute or two that you're in there. Personally, for myself, I do have Raynaud's, so it's not the best, but I've tried it once.
You treated me for sciatica with needling.
Yes.
It freaked me out to think about it. It's not acupuncture, but
Nope.
it's literally needles. Can you say something about that therapy?
Yeah, so trigger point dry needling is a tool that I'm certified in, and it is really good at, if you think of a muscle that's overactive and tight, it's not going to function the way we want it to. It's not going to be able to produce as much strength, and it can also create pain, referral pain. It's kind of like a reset switch for the nervous system for that muscle, where we utilize a needle. There's no like injection, so that's why it's called a dry needle. It is the same type of needle as acupuncture needles, except acupuncture works along the surface of the skin more so, along predetermined points, meridians, and works with more the flow of chi, more the flow of energy. I'm not qualified in acupuncture, so I can't fully speak to it. But dry needling, we find trigger points. So trigger point dry needling, we find knots essentially in the muscles that are producing that pain, and the needle going into it effectively kind of hits the reset switch, lets it relax, and then you can retrain that muscle afterwards in that more optimal tone and length of the muscle so that it functions the way we want it to and decreases pain after.
Sounds creepy, but yeah, you don't feel any pain.
Mm-hmm. It's uncomfortable, but yeah.
How big is a needle?
So they're very, very thin.
Oh,
Mhm.
like acupuncture?
Yeah. Mm-hmm. And then depending on the muscle that we're targeting, there are different lengths of the needles just so that we can get to the actual trigger point. Like some areas, like in the hip, like David can attest, the needle looks a little larger than we would appreciate, but it doesn't feel like you're getting stabbed, and it's a weird, deep sensation. It's almost like a toothache. It's like dull and achy, but it's quick, and then it's over. Yeah, and it works. I'm a big fan of dry needling. Any other questions? Who's avoided getting on and off the ground lately? Show of hands. Has anybody avoided getting on and off the ground? Well, hopefully, safely able to try it out. I would always recommend, if that's something that you're unsure if you can do it with a professional. So whether it's physical therapist, personal trainer, having somebody there that if you, in the worst case, can't get up, you do have somebody. But there have been a lot of studies that just show that that's a big component in how people feel after falls and their confidence too, and just risk in general for falls. If you are not regularly practicing getting off the ground, you're not going to be able to do it in the moment that you need it. But again, safety first. Don't try it at home unsupervised. But it's a big factor. Yes?
How do you measure adequate hydration?
So the optimal recommendation,
How do you measure adequate hydration?
if you take your body weight and divide it by 2, that's how many ounces of water you should be having. That doesn't mean that if, as everybody picks up their water bottles and starts chugging.
Pounds of water?
So your body weight in pounds, you divide it by 2, and that's the ounces.
Ounces.
If it was pounds of water, oh boy, that would be hard to maintain.
That's your archaeology.
So and again, that's kind of just standard every day. It changes if you're doing any sort of athletic activity, and again, it can vary based on the person. But that's like a ballpark estimate. I once had a patient, when I asked how much water do you drink, he said, pour myself a glass of water in the morning, and I put it on my desk. And I was like, okay. And he goes, and that's it. I don't drink it. So I'm not going to tell him you have to drink 64 ounces of water tomorrow. It's about gradually increasing the water intake. And again, if you know that you do not drink enough water, just trying to be more mindful, incorporate it more into meals, because hydration is very important. Not just in overall health, but also, again, preventing any sort of medical issue or fainting. Good question. Any other questions? All right, we do have some cards. We collected emails. We are going to be raffling off either a free massage or a free optimal health assessment. So if you have not given your contact information, Scott has the sheet, and we will be hearing from you guys. Thank you for having me.